Hello everyone, my name is Alexander Smith, and today I'm here to talk to you about why I believe OHIP should cover psychological services. Alright, let's begin. I wanted to start by going over what OHIP is and what OHIP covers. So OHIP is Ontario's health and insurance plan. It covers all of your doctor's visits, whether it's a general practitioner or a specialist. It covers all your hospital stays, any surgery you have, dental surgeries in the hospital count as well, abortion services, and ambulance services. Unfortunately, psychological services are not covered by OHIP. So it begs the question, why do we differentiate between mental illness and physical illness? I honestly believe it has to do with all the stigma that still surrounds mental illness. Depression, anxiety, schizophrenia, OCD, these are all ailments that can happen to anybody. So why do we treat them like they're different from any physical ailment? The main reason that I wanted to talk about this topic is because of the state of the world we're in right now. This pandemic has kind of fatigued our population. We have these stay-at-home restrictions, we're in lockdown, we're forced to isolate, and isolation can feed depression and anxiety. I honestly think it's deteriorating our population's mental health. And that can lead to increased substance abuse. It's also increasing a lot of physical roadblocks for people that are trying to access mental health services and substance abuse services. So I just wanted to go over some mental illness statistics regarding Canada. So in any given year, 1 in 5 Canadians are affected by mental illness. By the age of 40, 1 in 2 Canadians have had a mental illness. 40% of Canadians actually never seek any help. 70% of the onset of mental illness happens in early childhood, and low-income Canadians are 3 to 4 times more likely to have a mental illness. So a few more statistics. Mental illness can cut 10 to 20 years off a person's life. People with mental illness are 20% more likely to have a substance abuse problem. Furthermore, people with substance abuse issues are 3 times more likely to have a mental illness. And then 15% have co-occurring or reoccurring mental illnesses. Suicide is a major risk for our youth population and our Indigenous population in Canada. 4,000 Canadians a year die by suicide. After accidents, suicide is the second leading cause of death for 15 to 24-year-olds. It occurs across all ages, incomes, ethnicities, and social factors. It can be accidental or premeditated. We have to make sure that whoever needs support can get the services and therapies that they need. On a personal note, I can tell you that I have struggled with depression and anxiety for the majority of my life. And I can tell you right now that without cognitive behavioral therapy, I would not be here right now talking to you in front of this camera. So let's get down to what a psychologist does, kind of what they are. So a psychologist is a doctor in the field of psychology who've studied for at least 7 years. They've done their master's and they've done their PhD. They're trained clinically to help patients deal with certain things like depression, anxiety, OCD, eating disorders, substance abuse problems, and they use clinically proven techniques to help you overcome your issues. There's different types of therapies offered, so psychodynamic, cognitive behavioral therapy, humanistic therapy. They also run tests and diagnose patients to help determine what your mental illness is, if you have a mental illness, and what therapies you would benefit from. So I think the biggest issue a lot of people have with these therapies is the cost. Now, the cost of an assessment averages around $200, and then the cost of a weekly session averages around $200 as well. Depending on your employer, you can have some coverage, and then that will have a yearly max. As you can see on the screen, Sheridan covers up to 60% of each visit, and then a yearly total of $500 altogether. So you can tell that your visits will add up very quickly, and then your coverage will be gone, I think, after the 4th visit. So what can Ontario do? I think we need to increase the number of psychologists on payrolls in school boards and in hospitals. That way, if any child needs care, they can get tested, diagnosed, and then given the right care. I also believe that if a doctor refers you to a psychologist, OHIP should cover that referral and all the services provided by that psychologist. Overall, we must make these services accessible to all Ontarians, just like any other medical care. Thank you. That is my presentation. Bye.